Okay, so when we left off, you were writing down a bunch of clients or groups of clients that may be at risk for an infection. So let me give you some answers to that. So we talked about the immunocompromised, so that could be someone with rheumatoid arthritis, AIDS, any kind of autoimmune disease really, or someone who is elderly, someone who's had recent surgery, anyone who has an indwelling device such as a catheter or an IV, someone with broken skin, or a patient with impaired circulation, chronic disease, even a chronic pain disorder could lower the immune system and put a patient at risk for infection. Poor hygiene or poor nutrition. Smokers, alcoholics. What about a crowded habitat? So think of our people in the shelters. Those with poor lifestyle choices, such as IV drug users, those having unprotected sex. Or poor sanitation. Also, places where there's a lot of mosquitoes or parasites. Or perhaps someone who has been to a foreign country recently. So nursing assessment of infection. So that's your job, is to kind of keep an eye out on your patients to see if they have an infection. So some signs and symptoms would be fever, chills, increased pulse, also an increased respiratory rate, believe it or not, malaise, which is just a feeling of I generally don't feel well, fatigue, anorexia. We're not talking about anorexia nervosa, we're talking about just a lack of appetite. Nausea, vomiting, abdominal cramps, and diarrhea. The elderly have a reduced inflammatory response and may have advanced infection before identified, so they are going to have atypical symptoms. The elderly will usually be confused and suddenly become incontinent when yesterday they were continent, today they're not. You will also find a localized redness, warmth, edema, and pain or tenderness. That could be around a wound, perhaps. There's something called purulent exudate. Okay, purulent means that there's pus there, and an exudate is the drainage from a wound. That, if it's purulent, it's kind of yellow, maybe green, and that means there's an infection. Some labs may be done so we can see if they have an infection, such as white blood cells, if it's greater than 10,000. An increase in neutrophils, also increased erythrocyte sedimentation rate, or ESR, which is a marker of inflammation. So I suggest you go to box 23-1 in your Taylor's textbook. Not sure if that page number is right, but the box is right. And look at the lab results, and I would know those. So in addition, you might do a culture of the exudate in a wound, and you'd send it to the lab in order to make sure that the patient is put on the correct medication to get rid of the infection. Some diagnostic procedures that can be done to assess infection are the gallium scan, which is a nuclear scan with radioactive substance to identify hot spots of white blood cells. There's a radioactive gallium citrate, which is injected by IV and accumulates in the area of inflammation once again. X-rays, CT, MRI, biopsies all determine the presence of infection, abscesses, and lesions. So, nursing interventions and responsibilities of the nurse. Hand hygiene, here we go again. You're going to see that over and over. It's hand hygiene. We should educate our patients. What are we going to educate them on? Immunizations, good oral hygiene, adequate fluid intake. It should be about 2 to 3 liters per day, by the way. Pulmonary hygiene, which is turning and coughing and deep breathing. using the incentive spirometer every 2 hours, and we're going to teach you how to use the incentive spirometer so you can teach your patients. This is a device that will expand the lungs and clear pathogens. Nurses use aseptic technique, so you're going to wear proper gloves and PPE. We're going to do PPE in lab this week. Respiratory hygiene, cover the mouth and nose with a cough and sneeze. Use tissues for secretions. Wear surgical masks. Turn your head when coughing. Stay 3 feet away from others. Here we go again. Hand hygiene when you've sneezed or coughed. So isolation guidelines are a group of actions that include hand hygiene and the use of barrier precautions in order to reduce the transmission of infectious organisms. We have to remember that precautions apply to every client and every guest. So if someone is on isolation precautions or some kind of precautions, you have to make sure that it's not just you that go in and that has to wear things, it's also their guests, their visitors that come in. Okay. Changing PPE between clients and between messy procedures is important. Shoe covers should be used in the OR. And remember that if your clients are on precautions, they don't get a lot of visitors, and the nurses and aides don't really want to go in there, and they stand at the door, and they don't sometimes really want to touch them, and so these people get lonely. So we have to provide some kind of stimulation for them. Okay, so types of precautions. When we're talking standard precautions, we're just talking about gloves. Your regular old gloves you grab out of the box. Droplet precautions are used for things that a pathogen that is larger than 5 micrograms, so this is strep throat, pneumonia, flu, scarlet fever. The barrier precautions needed are a private room or a cohort client, so someone with the same illness. Mask should be worn when closer than 3 feet from a client for your droplet precautions. We're going to go over this in lab in much more detail. Okay, so just take basic notes now. Contact precautions should be used within 3 feet of the patient. This should be used with RSV, Shigella, any enteric precautions like GI stuff, wound infections, herpes, impetigo, scabies, or a drug-resistant organism. For diseases transmitted by direct client or environmental contact, that's when we would use these contact precautions. So the barrier protection needed is a private room or a cohort client, once again someone with the same things, the same disease. Gloves, gown, goggles, if secretions may happen to come in contact with your mucous membranes. It's happened before. And you may have some certain designated equipment, such as equipment that stays in the room in order to take vital signs, including a disposable stethoscope. Airborne precautions are for droplets smaller than 5 micrograms, such as measles, varicella, or tuberculosis. This requires a private room. Masks and respiratory protection, such as an N95 mask, you'll get to check those out in lab this week. And negative pressure airflow exchange room. So think about that for a moment, what a negative pressure might mean. If you have tuberculosis, you'd want to get that air to the outside of the hospital and not circulate it to other rooms. Let's talk about aseptic technique. What is it? Well, there's 2 types. There's medical and surgical. So aseptic technique is just a general term used for the absence of illness-producing microorganisms. So medical asepsis is a clean technique. So it's a practice to reduce the number, growth, and spread of microorganisms. You would use it to administer oral meds, managing the NG tubes, providing personal hygiene, and many other nursing tasks. Surgical asepsis is more of a precise practice that would eliminate all microorganisms from an object or an area and prevent contamination. So, medical asepsis is hand hygiene. When to use it? When a clean technique is warranted, not necessarily sterile, you're going to use regular gloves. So we talked about when you're going to administer oral meds, you're going to insert an NG tube or check for placement. If you're providing personal hygiene for the patient, changing their bed linens, cleaning bedside stands or floors. And a couple additional things to think about would be not to shake the linens when you're changing them, because when you shake the linens, germs are going to fly everywhere. You're going to clean a soiled area first, okay, so that it's not going into all the other areas. So think if there was something on the floor that you had to clean up, blood or something, you would clean the blood up first and then clean the whole area. Plastic bags would be used for contaminated items, so you're not going to carry your linens down the hall in your arms. They will be put into a plastic bag. Pour liquids into the drain. Have short nails, and they can't be fake nails. Wash your hair and pull it back. And no jewelry, because those rings can really hold some bacteria. When do we use surgical asepsis? Well, when we're given a parenteral med, such as an IV med, insertion of a urinary catheter, some surgical procedures, well, all surgical procedures, sterile dressing changes. Now look at these pictures here. You're going to see what the person is working on here is a table, and there's a sterile drape on it. So everything on that table is sterile. So we're going to do a little bit of this in lab. Maybe not this week, but within the next few weeks. Okay? So that person's hands are completely sterile that are touching the table, and they have sterile gloves on. Not regular gloves, sterile gloves. So always remember to bring 2 pairs of gloves with you in case one of the gloves gets contaminated or rips. If you turn your back on the sterile field, it is considered contaminated. Waist level and down is considered contaminated. And check the sterile packages for damage and expiration. Let's talk about some more important principles to remember. Sterile touching sterile remains sterile. Sterile touching clean becomes contaminated. So if you have on a clean glove and you reach on that sterile table, the whole table is contaminated. Sterile touching contaminated, of course, becomes contaminated, right? So if I take a piece of hemostats, say I take my hemostats and I touch it to the patient, it's now contaminated. You cannot put it back on the sterile table, although you will see that done, but you should not. If the sterile state is questionable, discard it, throw it out. It's always the right answer, and start over. Only sterile objects can be placed on a sterile field, obviously. A sterile barrier that has been permeated by punctures, tears, or moisture must be considered contaminated. The edges of a sterile field or container are considered to be contaminated. So, once you open a sterile package, the 1-inch border around the edges is considered unsterile. And we're going to practice this in lab. Tables draped as part of a sterile field are considered sterile only at table level. A sterile object or field out of the range of vision or object held below a person's waist, so remember below the waist is contaminated. Movement around and in the sterile field must not compromise or contaminate the sterile field. And the sterile object or field becomes contaminated by prolonged exposure to air. So you can't leave it sitting out on air forever, even if it is just covered by something. You have a time limit there. Okay, so we're going to do a part 3 and go over some practice questions. Make sure you read chapter 10 of your ATI Fundamentals book before lab. Pay special attention to nursing interventions. Write it out and bring it to lab over the next few weeks.